My dear friends, if you are over 60, there is something sitting right now in your bathroom cabinet or perhaps on your kitchen counter that you reach for every single day. It's the simple promise of relief. It's the bottle that helps you manage that stubborn knee pain when you want to garden or the shoulder ache that keeps you from sleeping through the night. It is so common, so readily available, that we often forget it is medicine at all. But I need you to stop right now and listen closely. Because this common pill, taken casually for years, is quietly putting an enormous unnecessary strain on the one organ you absolutely must protect if you want to keep your independence: your heart. We're talking about the very common, inexpensive pain relievers known generally as NSAIDs. Think of the pills you take when your arthritis flares up, or that dull ache in your lower back just won't quit. They give you relief, yes, but they demand a high price from your internal system that most doctors forget to warn you about, simply because they assume you wouldn't take them every day. For people over 60, these drugs are dangerous because they are invisible troublemakers. You might think you are doing everything right. You watch your sodium, you avoid sugary drinks, you try to take a walk every morning. Then you go to the doctor, and the nurse takes your blood pressure, and it is higher than it should be. The doctor adjusts your BP medication, maybe adding a new prescription, and tells you to monitor it. But the reading keeps creeping up. Nobody asks about the small white pill you take every evening, just so you can stand up without wincing. That is the danger. That innocent little pill is often the direct cause of your rising blood pressure. Here is the simple, physical truth. These pills work by affecting certain chemical pathways in your body, which is how they stop pain and inflammation. But those same pathways are critically linked to your kidneys. When you suppress them regularly, especially as your kidneys age and slow down naturally after 60, your body begins to retain sodium and water. Think of your circulatory system like the plumbing in your home. If you suddenly force more water into the pipes without increasing the diameter of the pipes, what happens? The pressure skyrockets. That extra fluid retention puts massive pressure on your arteries and veins, forcing your already aging heart to pump against much higher resistance. This isn't just a minor side effect. It is chronic, silent stress that pushes your blood pressure into the danger zone. High blood pressure is the silent thief of independence. It doesn't give you dramatic warnings. It slowly hardens your arteries until one day the pressure causes a critical break or blockage. That is a stroke. That is a serious heart event. And for us, after 60, a stroke means the quick end of our independence. It means needing permanent assistance. It means giving up the car keys, giving up the garden, and perhaps even leaving the home we worked so hard to keep peaceful. This is not a matter of fear. It is a matter of knowing the facts so you can protect yourself and your family from sudden tragedy and financial hardship. The sad part is that many seniors rely on these easily accessible cheap pain pills because they are desperately trying to avoid expensive prescription medications or joint replacement surgery. They are trying to be strong and manage their pain alone, and every time they reach for that bottle, they feel a sense of control, but they are actually inviting danger. If you are taking ibuprofen, naproxen, or any similar non-steroidal anti-inflammatory drug more than 3 times a week, you need to treat it as seriously as a prescription blood thinner or a heavy narcotic. And please, remember this vital instruction. When you go for your annual doctor visit, or even if you just call the nurse, you must disclose every single over-the-counter item you take, even if it is just a children's aspirin or a vitamin C tablet. If it goes into your body, your doctor must know, especially the pain pills. Do not let the fact that you bought it at the pharmacy without a prescription make you forget to mention it. Think about how much effort you put into maintaining your home. You fix the leaky faucet, you trim the hedges, you ensure the smoke detector batteries are working. You do these things because you are protecting your security and your biggest investment. Now, apply that same vigilance to your body. Your body is your most valuable asset. It is the vessel that holds your memories and allows you to enjoy your remaining years in comfort and dignity. We cannot let a common, inexpensive pill quietly jeopardize that peace. If you have been taking one of these NSAID pain relievers regularly, the first step is simple. We need to find safer methods for managing that daily joint pain immediately. We need to preserve your kidney function and bring that blood pressure down. Stopping the medication is only the beginning. Next, we need to talk about what to do instead. We need practical daily habits and specific, safe alternatives that manage that chronic inflammation without putting the squeeze on your arteries. And more importantly, we need to address the other major hidden risk many seniors take that is putting your heart under even greater strain than those pain pills. This risk isn't in your medicine cabinet, it's in your refrigerator, and it's a habit we all picked up decades ago that we must break now for the sake of our longevity. We'll discuss that crucial change in the next part. If you've been taking that little white or blue pill for chronic knee pain, or perhaps for a shoulder ache that just won't quit, I want you to listen closely now. We are talking about medications you trust. They sit in your bathroom cabinet. They are the names you recognize instantly. Ibuprofen, Naproxen, or perhaps the store brand version you picked up at the dollar store. These are what doctors call NSAIDs. And while they are brilliant at quieting inflammation, they have a secret habit of stressing your heart and kidneys. Now, this isn't happening to everyone, but if you are over 60, and especially if you already manage high blood pressure or diabetes, this hidden danger becomes critical. Let's look at exactly how they quietly turn up the pressure inside your body. When you take these pills regularly, not just one day, but day after day for a stiffness or ache, they interfere with your body's natural chemistry. Specifically, they disrupt the way your kidneys handle salt and water. Think of your body as a network of pipes. If the pill makes the kidneys hold on to too much salt, the body must hold on to water to dilute that salt. This means you are essentially carrying extra water weight inside your veins and arteries. More fluid in the pipes means the pressure goes up. Even a small silent rise in blood pressure, say 5 or 10 points, is a huge burden on a heart that has already worked faithfully for 6 or 7 decades. It forces your heart muscle to pump harder against this resistance, day in and day out. This continuous extra effort can lead to the thickening of the heart walls and eventually a weakened ability to pump efficiently. This isn't an emergency you feel today. It's a slow-motion stress test that only shows up years later, perhaps when a routine blood pressure check suddenly reveals a worrying number. And here is the quiet trap: the dosage. Because these pills are available over the counter, we assume they are totally safe at the maximum recommended dose. Perhaps you take 600 milligrams of ibuprofen 3 times a day just to manage that chronic arthritis pain. That heavy, steady dose is enough to significantly interfere with your blood pressure control. It becomes a vicious cycle. You take the pill to feel good enough to walk or work in the garden, but the pill itself is silently pushing you closer to the very events you fear most: a stroke or a severe heart incident that could steal your independence. We often focus so much on the major prescription drugs the doctor gives us that we completely forget to check on the small, common pill we've been buying ourselves for years. This is especially critical if you are already taking medication for high blood pressure. For example, many seniors take diuretics, those water pills that help flush excess fluid out of the body to lower pressure. If you take a diuretic to lower your BP, and then you take ibuprofen regularly, the ibuprofen works against the diuretic. It cancels out the good work of your prescription. It's like driving your car with one foot on the gas and the other on the brake. You are spending money and effort on heart protection only to sabotage the result with a common pain reliever. How many times have you reached for that bottle on Sunday morning before church or before tackling that pile of laundry? It's automatic, it's routine, it's trusted. The key to protecting yourself and keeping your independence is to change the automatic routine, starting tonight. You must stop treating chronic daily pain with chronic daily NSAID use. These pills were designed for temporary problems, a pulled muscle, a short-term fever. They were not meant to be a permanent solution for the wear and tear of aging. Taking them every day, even for months, vastly increases the risk of heart complications. We must find the hidden connection between your daily aches and your overall health plan. Your doctor or pharmacist knows your full medical history. They need to know about every single pill, even the one you buy yourself at the grocery store. Do not be shy about this conversation. Protecting your heart is protecting your independence. Now, you might be thinking, If I stop taking my usual pain pill, how am I supposed to manage the ache that keeps me awake at night? That is precisely the wisdom we need to talk about next. In Part 3, we are going to walk through the 5 simplest, most effective substitutions, safe methods, and surprising habits that can turn down the volume on chronic pain without silently turning up the pressure on your heart. We'll look at alternatives that actually help protect your heart while relieving your pain. This knowledge we are sharing is not meant to frighten you. It is meant to empower you. We have seen how that familiar little pill sitting innocently on the bathroom shelf can secretly push against your heart. It adds silent strain. It makes the work of your other medications harder. Now, let's talk about the practical shift. What do you do right now when the familiar ache returns? Maybe it's your knees talking back after a busy morning in the garden. Perhaps it's that nagging stiffness in your shoulder reminding you of the fall you took last winter. Before you reach for the bottle of ibuprofen or naproxen, pause. We need to interrupt that habit. This moment of pause is a moment of protection. Your safest first choice for everyday muscle aches, joint pain, or tension headaches when you have heart health concerns is usually acetaminophen. You probably know it as Tylenol. Acetaminophen does not carry the same risk of increasing blood pressure or causing the sodium retention we discussed. It lets your kidneys and your heart rest easier. But here's the absolutely crucial part, and please pay close attention. While acetaminophen is kinder to your heart, it is very tough on your liver if you take too much. This is where clarity and caution become your best friends. For seniors, the recommended maximum daily dose of acetaminophen is often lower than what is printed on the bottle for younger adults. Do not, under any circumstances, exceed 3,000 milligrams in a 24-hour period unless your doctor has specifically told you otherwise. In fact, many experts suggest keeping it safely below 2,000 milligrams a day if you take it regularly. The danger is hiding in plain sight. Many cold medicines, sleep aids, and prescription painkillers already contain acetaminophen. They might call it APAP or paracetamol, but it's the same drug. This is why you must become a detective in your own medicine cabinet. Go through everything. If you are taking a pill for a headache, a pill for a cold, and a prescription for your back pain, you might be accidentally tripling up on acetaminophen without knowing it. That is a fast path to liver trouble, and the symptoms are often silent until serious damage has occurred. The goal here is simplified living. We want fewer worries, not more complexity. We want to secure your independence by keeping your body strong and your systems clear. If you find yourself needing a pain reliever every day, even acetaminophen, it is a signal. It's a signal that the underlying problem needs attention. It means it is time to have a serious, honest conversation with your primary care doctor. Do not just mention the pain in passing. Be specific. When you call, you should say, "Doctor, I am managing chronic knee pain, and I am trying to avoid NSAIDs because I am worried about my blood pressure. I need your guidance on a safe, long-term pain management plan that protects my heart and my liver." This script puts you in charge. It shows you have done your homework, and it guides the doctor immediately to the heart of your concern, safety and longevity. They may suggest other options, prescription pain patches, topical gels that absorb locally without affecting your whole system, or physical therapy. Remember, sometimes the wisest pill is no pill at all. Think about what keeps you independent. It is mobility. It is being able to get out of the chair, walk to the mailbox, play with the grandkids on the floor, and maintain the small dignity of your own home. When pain is mismanaged, or when the medicine you rely on starts stealing health elsewhere, that independence is compromised. You start falling more often. You limit your outings. You spend more time alone on the sofa. This journey through our medicine cabinets and pharmacies is really about protecting the quality of our later years. It's about not letting a minor ache become a major crisis that lands us back in the hospital. We need to review one more critical area of daily wisdom. We have talked about the pills that threaten the heart by raising blood pressure. But what about the habits that threaten the heart by raising stress and isolation? In Part 4, we are going to pivot from the physical protection of the heart to the emotional protection of the spirit. Loneliness and stress are just as dangerous as any NSAID overdose. We will explore simple, practical ways to build connection and secure your peace of mind, especially when dealing with the realities of living alone or adjusting to widowhood. Get ready, because the simplest wisdom often brings the biggest relief. We have spent time peeling back the layers on this quiet danger, the common pain relief tablet sitting innocently on your counter, holding the potential to slowly steal your heart health and compromise your hard-won independence. We know now that the very act of chasing temporary relief can lead to a silent, creeping spike in blood pressure. That subtle rise is the true enemy. So, what does wisdom demand of us now? It demands action, not panic. It demands preparation, not fear. The next time you measure your blood pressure and you see that number sitting stubbornly high, maybe 140/90 or even higher, do not immediately blame the salt shaker or stress from yesterday's bills. Pause and look at your medicine cabinet. Ask yourself this critical question. How many days this week did I take that common pill for my aching back or knee? This vigilance is your strongest shield. It is the key to managing your health without constantly depending on doctors or specialists. Now, let's talk about the practical step that restores your power, preparing for your next doctor's visit. Many of us go to the doctor and rattle off a list of our prescribed medications. But we forget the ones we buy ourselves, the over-the-counter heroes we think are harmless. This is where you must assert your knowledge. You pay attention to the wisdom we share here. You are informed. When the doctor asks about your routine, don't wait for them to ask about pain relief. Bring it up. Look them in the eye and say, simply and clearly, "Doctor, I take," name the pill, Ibuprofen, Naproxen, etc., about 3 or 4 times a week when the weather changes and my knee flares up. I've heard that this specific type of medicine can slowly increase blood pressure. Could this be contributing to the readings you see today? This statement changes the entire conversation. You move from being a passive patient to an informed partner in your care. This is what true independence looks like in your 60s, 70s, and beyond, the ability to ask the right specific questions that protect your future. If your doctor confirms your suspicion and asks you to stop, you might feel a wave of worry. But how will I manage the pain? I can't live glued to the couch. This leads us to the heart of the sabiduria do idoso, finding simple, low-cost ways to soothe daily discomfort without relying on chemical crutches. These are the habits that keep you moving, keep you playing with the grandkids, and keep you financially sound. For joint pain and muscle aches, often the solution is already in your home, waiting patiently. Consider simple heat therapy. A warm bath before bed or a low-cost heating pad applied directly to the lower back or knee for 20 minutes can dramatically reduce inflammation and stiffness. Heat improves circulation, flushing away the very things that cause discomfort. This is free or nearly free medicine. If the pain is sharp and sudden, sometimes cold therapy, a simple bag of frozen peas wrapped in a thin cloth, can be used sparingly to block nerve signals. Remember the power of gentle movement. Stiffness leads to pain, and pain leads to pills. Break the cycle. Before you get out of bed in the morning, do 5 minutes of slow, small movements, ankle rotations, knee bends, or gently reaching toward your toes. It seems minor, but these simple stretches are a vital investment in your mobility for the day ahead. We are seeking a peaceful, predictable life. A life where your home is safe, your finances are secure, and your health is stable. Protecting your heart from those hidden pill dangers is not just about avoiding a diagnosis, it's about protecting your savings. Think about the cost of a cardiac event, a trip to the emergency room, or the ongoing expense of new prescription blood pressure medications. These are the financial drains that erode your security and threaten the independent retirement you've worked so hard for. By making the wise small choice today, by questioning that little white pill, you are literally banking money against future emergencies. You are protecting your peace of mind. This is the deeper meaning of aging well, understanding that health choices and financial choices are completely intertwined. One protects the other. As you step away from relying on painkillers that silently stress your system, you are stepping toward a calmer, more predictable daily routine. You are regaining control over your body's most crucial engine, your heart. We've focused heavily on protecting the inner machinery of your life, your health, and your finances. But the wisdom of aging also means protecting your sanctuary, your home. Many of the dangers we face after 60 aren't quiet medical issues. They are right under our feet, in the most familiar places. We often overlook the one item in our homes that causes the most falls, shatters independence, and leads to the highest hospital bills for seniors. In our next discussion, we will apply the same lens of wisdom and vigilance to the physical structure of your life. We will identify the single most common tripping hazard hiding in plain sight in your living room and kitchen, a danger far more common than clutter or poor lighting. A simple correction that can save your bones and your savings. Stay vigilant, stay safe. And remember, the wisest decisions are often the simplest ones you make today.